Hi everyone, my name is Maja Kuharic. I'm assistant professor at Northwestern University at Feinberg School of Medicine at the Department of Medical Social Sciences, and I'm fortunate enough to receive the faculty starter grant from PhRMA Foundation. I didn't start out thinking that I'd become a scientist. I grew up in Croatia, where opportunities in research are somewhat limited. And pharmacy to me seems like the most direct way to make a difference in people's lives. But working as a pharmacist, I realized that patients often don't take their medications, not because of the medications itself, but a lot of things play in that role, like family dynamics, stress, finances play a huge role. And that made me more curious about what really drives outcomes in healthcare. My first job in the USA was working as a pharmacist at a homeless shelter in Florida, which again showed me how complex healthcare in the United States becomes when you have access barriers to healthcare and when you have a lot of financial struggles. So my research funded by PhRMA Foundation focuses on understanding how patients' feeling of being a burden to their caregivers, to their family, influences their healthcare decisions. So when we evaluate treatments, we look often at survival, we look at symptoms. In value assessment, we looked at cost effectiveness. And we try to measure, we look at caregiver burden, but we've always measured that from caregivers' perspective. So we rarely asked patients themselves. And many patients who depend on family support feel like a burden to them. We know by statistics that 1 out of 5 Americans, they serve as informal caregivers. They provide unpaid support to individuals like their family members, a friend, to help them with chronic illness, disability, or some other health conditions. So these feelings that patients feel like a burden to their caregivers make them decline treatments, delay care, or skip medications. And again, it's not because of the side effects, often not because of the cost, but because they don't want to stress their families and they don't want to ask for help. But let's say we have medications that it help them stay independent longer. And that's hugely valuable. Let's say they maintain dignity, they maintain independence, and this reduces the burden it places on their family. So this treatment didn't just improve patients' quality of life, it might affect their spouse's ability to work, it might affect their children's caregiving responsibility, it actually affects the whole family's financial and emotional well-being. So if we're not measuring this, we might actually be underestimating the true benefits that treatments have. Under this PhRMA Foundation grant, first, we are interviewing patients, we're interviewing caregivers and clinicians to understand how these feelings affect real-world healthcare decisions. Then we will be using quantitative methods to see how much patients actually value reducing these burdens compared to other aspects of their life. A third part of this grant, we want to get some feedback from stakeholders like payers, clinicians, advocates, to see how could we make this useful, how could we integrate this in any value assessment framework. Because we're looking here how to basically broaden how we define value and to measure actually what truly matters to people. What I found most fulfilling about my work is connecting research with actually real human experiences. So I work in patient-reported outcomes, so we develop measures, we validate them. So we're actually measuring health from patients' perspective. So I tell the people there is no blood test for depression, there is no scan for anxiety, and there is no lab value of how much someone feels like they're a burden to their family. So the only way we can capture these experiences is that we ask patients directly and really listen to them. So turning those experiences into some measurable data or outcome that can guide policy, that can improve care, that actually improves patients' quality of life, is that something that I find deeply fulfilling, and it really kind of is very satisfying. Find some research questions from real problems that you see, not just gaps in the literature. So think about the impact that your research can have from day one. If you pursue this research, like who will care? Will it change any policy? Will it change any practice? Does it have any positive impact on people's life? So if you cannot really articulate that, I suggest to talk to some patients, talk to some policymakers, talk to some stakeholders on what their needs are and how you can fill those. I'm interested in exploring methods that capture the value of innovative medications more broadly. So not just looking at impact of patients, but on whole families. So how treatments affect family dynamics, household productivity, and all this relationship between patients, their caregivers, well-being that current value frameworks don't address as much.